Hello, I'm Bullwhip with U.S. Border Watch here in Houston, Texas, and I want to talk to you about a concern I have concerning the food industry here, the restaurants, etc. I have an article here from the Phoenix Business Journal, Friday, May 26, 2006. It says, "Illegals' presence deepens health concerns in the food industry." I myself have been worried about this a long time before reading this article. Studies by the National Health Institutes of Health and articles of various medical journals point to higher rates of tuberculosis, malaria, blood disorders, and diseases in Mexican border regions and other third world countries than in the U.S. Some of these diseases are rare and non-existent here. Some cities in other states, including Massachusetts, have started cracking down on restaurants that hire illegals, citing not only violations of federal employment laws, but also public health protection. There are about 12.5 million restaurant workers in the U.S. and more than 200,000 food service and restaurant workers in Arizona, according to the industry associations. The U.S. Department of Labor estimates there are 1.6 million foreign-born and immigrant workers in the food service and restaurant sectors nationally. They are a substantial part of our workforce, says Steve Churchy, president of the Arizona Restaurant and Hospitality Association. Now, I've been a paramedic now 15 years, been in EMS for about 20 now. Some of these diseases I've seen around this area, some of them I haven't. Some of them are very rare to see, but they're coming back. Malaria was eradicated from the U.S. in the 1940s, but recently there were outbreaks in Southern California, New Jersey, New York City, and Houston. Additionally, malaria-tainted blood has been discovered in the blood supply. Dengue, which was first recognized in the 1950s, it affects most of Asian countries and has become a leading cause of death among children in the affected areas. Heretofore unknown in the U.S., dengue outbreaks have now occurred in the United States. Leprosy, a scourge of biblical days, is caused by a bacillus agent and is now known as Hansen's disease. In the 40 years prior to 2002, there were only 900 total cases of leprosy in the United States. In the following 3 years, there have been 9,000 cases, and most were illegal aliens. Hepatitis A through E is a viral infection that primarily attacks the liver. In 2004, more than 650 people contacted hepatitis A at a single Chi-Chi's restaurant in Pennsylvania. 4 later died. Hepatitis B is one of the major diseases of mankind and is a serious global public health problem. It is estimated that 2 billion people are infected and about 1 million persons die each year. Tuberculosis, TB, kills approximately 2 million people each year, and it's estimated that between 2002 and 2020, approximately 1 billion people will be newly infected. Over 150 million people will get sick, and 36 million people will die. TB is a highly contagious disease. Like the common cold, it spreads through the air. When infected people cough, sneeze, talk, or spit, they propel TB germs, known as bacilli, into the air. Each person with active TB will affect, on average, between 10 and 15 other people every year. The United States currently has one of the lowest rates of TB in the world. Mexico has 10 times the rate of TB prevalent in their area, and many African countries, along with Afghanistan, Cambodia, and the Philippines, and the Indonesias, have rates that are over 100 to 150 times higher than the United States. Making matters worse, a few years ago, a multi-drug resistant strain of TB has emerged. That is resistant to all standard anti-TB drugs. Treating a single cause of multi-drug resistant TB costs over $250,000 and as much as $1,200,000 per person, and even with treatment, about half of the patients with multi-drug resistant TB prematurely die. There was a TB outbreak in Oklahoma City in a hospital affecting thousands recently. Chagas disease. I'm not even going to try to pronounce that word. It's from South and Central America. It's spread by an infectious trachomacoc bug known as a kissing bug that bite people. It was unknown in the United States until fairly recently. It is now estimated that between 100,000 and 500,000 people in the U.S. have Chagas disease. Who is infected? Mostly illegal aliens. Since Chagas disease is basically unknown outside of the illegal alien community, most doctors won't recognize it, and the blood supply just started being screened for it. Most cases of Chagas disease that occur in patients other than illegal aliens are thought to be contacted from tainted blood. Blood sold by illegal aliens with Chagas disease before the blood supply started being tested. That was back in August of 2006. They started testing it. HIV, the number of illegal and Mexican Central American immigrants with HIV or AIDS is unknown, mostly because the researchers rarely ask about immigration status. However, it is known that the rate of HIV infection among Latino women in California is about twice the rate of white women. At one free California health clinic, all of the women have HIV and AIDS. Most are Mexican or Central American immigrants. There are other diseases. I'm going to try to pronounce this. Schistosomiasis, the Guiana worm infection, whooping cough, cysticercosis, or Morgellons, as a host of others. Now, what I'm concerned is, when I worked in Mississippi in the food service field, we were required by the health department to go and be tested to be able to work in any restaurant. That was the state law. As far as I know, there is no law on the books in Texas with this requirement. Where are you eating tonight? This is Bullwhip with U.S. Border Watch, signing out.